In this video, we will present a research study that was conducted to better understand how treatment choices in UCD are made. In our last video, we spoke about the two different treatment paths available to patients living with UCD: medical management and liver transplant. Families, doctors, and other members of the care team try hard to understand and weigh the risks and benefits of medical management and liver transplant. But not a lot of research has been done to compare the outcomes of these two treatment options. This means there is a limited amount of scientific information families and providers can rely on to make this treatment choice. Since both treatments carry their own set of risks, patients, families, and their care teams often face a difficult dilemma. Should the child's UCD be treated with medications and restrictive diet, or should they consider undergoing a liver transplant to prevent future episodes of high ammonia? Given how complicated treatment choice in UCD can be, we set out to understand how treatment decisions in UCD are made. We were interested in the factors that families consider when making the choice between medical management and liver transplant. We will first describe why and how we performed this research study. We will then discuss what we learned about treatment choice in UCD from this research study, including the clinical, personal, social, and healthcare system issues parents consider when weighing the choice between medical management and liver transplant, and other important parts of the treatment choice process for families affected by UCD. Why is this research question important? By describing how treatment decisions in UCD are made, we hope to highlight the experience of patients and families. We want to give everyone involved in the care of people with UCD a better understanding of the reasons families may choose one treatment path over another. With this information, families, physicians, and other members of the care team can be better prepared to talk about the issues that matter most to UCD patients and their families. We held a combination of phone interviews and live focus groups to collect the data for this study. We spoke to 65 parents of children diagnosed with UCD. The parents who participated in this study had children of all different ages and different levels of UCD disease severity. Some of the parents we spoke to had a child who underwent liver transplant early in life. Some had a child who underwent liver transplant later in childhood or adolescence. And some were using medications and diet to manage their child's UCD. We also spoke to 45 UCD clinical providers from all over the United States. The clinical providers we spoke to included metabolic physicians, genetic counselors, dietitians, liver specialists, and transplant surgeons. We used the data we collected from interviews and focus groups to identify the most important and common factors families consider when weighing the choice between medical management and liver transplant. These factors fell into 4 categories, including the child's clinical status, the impact of UCD and UCD treatment on personal and family life, the child's social interactions with peers and their community, both now and in the future, and issues related to the healthcare system and the way it helps and hurts the care of patients living with UCD. Next, we dive deeper into each of these categories and discuss what we learned from our interviews with parents and providers. Now, we'll share what we learned from our interviews with parents and providers and dive deeper into the clinical, personal, social, and healthcare system level issues they consider when making the choice between medical management and liver transplant for their child with UCD. We'll be focusing on a few of the most commonly discussed considerations, but we won't be able to talk about everything we learned from this research study. If you would like more information about the results of this study, you can access a copy of the published journal article by clicking on the Links tab of this application. The severity of their child's UCD diagnosis and the stability of their child's disease were both important factors for parents when thinking about options for treatment. For example, When a child goes through a period of frequent episodes of high ammonia and many emergency visits to the hospital, parents can feel motivated to explore transplant as an option. Some parents viewed liver transplant as a way to prevent future episodes of high ammonia and preserve their child's brain function. For these parents, the unpredictable nature of high ammonia was enough for them to seriously consider transplant, even if their child's UCD had, until now, been relatively stable and under control with medications and restrictive diets. One parent had this to say about their choice to pursue liver transplant as a way to prevent future episodes of high ammonia.
Tons of reasons as to why we felt transplant was a better option, even though he was quite a stable kid so far. But everybody had told me that might not be the case forever. That can change literally overnight. So that's why we decided to go for the transplant.
Parents spoke in great detail about the day-to-day challenges of managing UCD and the burden that this can place both on the child and on the family. All families we spoke to could relate to the impact of 24/7 medical caregiving, the constant feelings of fear, worry, and anxiety, and how difficult it can be for the family to cope with changes to normal life comforts like food and travel. For some parents, these day-to-day challenges provided enough reason to consider transplant as a treatment alternative for their child. For others, the new and unfamiliar risks and burdens of transplant worried them more than the idea of continuing to cope with the very difficult but more familiar challenges of medical management. One parent had the following to say about the impact of UCD on their family's quality of life.
It really impedes your life, your family, and I wouldn't want that for any new family. If we could protect them and they don't have to ever go through it, and if transplant is safe, with it being as safe as it is, then that's always an option. The lack of sleep and constant worry, completely sleep deprived because you check to make sure they're fine all night. The stress of what if something happens, that takes many years off your life.
Parents valued learning about the treatment experiences of other families affected by UCD and the impact that medical management and liver transplant has had on their children's short-term and long-term outcomes. The child's level of independence was one outcome on the forefront of many parents' minds. Parents often worried about how medical management or liver transplant could affect their child's ability to participate in school, interact with peers, and one day even live as an adult outside the parent's home. For some, this was a major reason to pursue transplant. These parents believed that liver transplant offered their child a pathway to greater independence. Other parents felt that, over time, they could prepare their child to live a safe and independent life while managing their UCD with restrictive diets and medications. One parent had the following to say about their child's future independence and the way it influenced their choice to pursue liver transplant.
For her independence, a transplant is necessary. When her ammonia levels start to rise, she can't make decisions on how to help herself. Living on her own and going away to college was not going to be an option.
The healthcare system itself can also have an impact on the way patient, parents, and families view treatment options for UCD. This can include things like the physician's approach to treatment counseling, the cost and insurance coverage of medications, medical foods, and liver transplant surgery, and whether or not a family has access to high-quality metabolic care. A family's experience with their child's metabolic and emergency care teams may influence treatment choice. Families that were concerned about local metabolic care or the emergency medical services available in their area were often driven to consider transplant. When parents don't feel confident that their child's disease can be well managed by the providers and the hospitals where they live, they may view liver transplant as a safer alternative, even though it carries its own set of risks. On the other hand, parents who trust their metabolic and emergency care teams to manage their child's UCD were often less motivated to explore liver transplant. One parent had the following to say about the quality of their metabolic care and how this influenced their choice to continue medical management for their child.
I am confident that if she does get sick, that we're in the right place. I trust the team here very much. The reason liver transplant is not forefront in my mind is because we are with this department and we are with this doctor.
Now, we'll discuss two other important parts of treatment choice in UCD that were identified through the interviews and focus groups conducted in this study. Changes during a child's development can create new challenges for the continued medical management of UCD. For example, as a child moves from infancy to early childhood, they may be ready for solid foods, and parents may face a new set of feeding challenges. When the child becomes old enough to attend school, parents face new questions about how to handle that transition or whether or not their child's disease can be managed in a school setting. When the child becomes an adolescent or young adult, parents may start thinking about their child's long-term independence and their ability to live safely outside the parent's home. These transitions can change the equation for patients and their families and lead some parents to reconsider transplant as an option for their child. One parent had the following to say about these developmental milestones.
It's just a new chapter in our lives. In order for the possibility of her being able to maybe go to college, just be able to think about things like that, transplant has to be an option. If we can't get it under control now, I don't know how we're going to be able to get it under control in the next couple of years.
Our study showed that parents who eventually choose liver transplant as a treatment for their child reach a tipping point when they feel they are no longer able to manage their child's UCD through diet and medication. If, when, how, and why this does or does not happen varies widely from family to family. For some, a tipping point is reached shortly after their child's diagnosis. Some families never reach a tipping point where transplant is a true consideration. Others face their own personal tipping point after years of medical management and key changes in their child's and their family's circumstances. One physician had the following to say about their experience counseling families during a tipping point.
Finally, push came to shove where it was the kids were coming in too frequently or their ammonias were being too problematic, difficult to treat. Then we finally made the decision when that balance or scale seemed to tip. Every child is different and every child comes in with a different set of issues. Whether it's the diet, whether it's the medicine, whether it's just the lack of activity or just feeling out of it all the time, whether it's hyperammonemic crises, bringing them in frequently, these are all issues that come into the play of whether or not you go ahead and you finally make a transplant decision.
All of the issues we spoke about today are pieces of a complex process families undergo when they navigate the choice between medical management and liver transplant. No experience will be exactly the same, and each family will take into account their own personal priorities, preferences, and circumstances when making this choice. In the next video, we will be talking about the results of a study that compared outcomes between two groups of patients with urea cycle disorders. One group that had a liver transplant at some point in their life, and one group that has continued treatment with medicines and diet.